Okay, yet again I'm here to explain to you abuse of antibiotics vis-a-vis antimicrobial resistance. And at this point we want to look at when do you need antibiotics and when you don't need antibiotics. Abuse of antibiotics is considered in a way that these antibiotics are not prescribed by the health worker, but you go yourself to a drug shop where they sell drugs, and you procure what you want. For example, amoxicillin is treating cough, but you have flu, but because you fear to get cough, what you do is you order for antibiotics without any prescription. And they also give you because they need the money. So at the end of the day, the flu will continue. Instead of buying antihistamines, you buy anti-coughs. So the flu will continue, and the amoxicillin won't work on the flu. So what happens? By the time you get a cough, you want to take antibiotics, and you procure the same antibiotic which you know. So you'll find that the progress of the cough will just continue despite your swallowing of antibiotics, of the good antibiotics you think you are swallowing. So at the end of the day, you would have abused the antibiotic because it's not working, though it is a good antibiotic. So that one explains a bit of abuse of antibiotics and a bit of resistance, because when you have resistance, it means you have an infection, but the infection itself is not responding to antibiotics you are using, and it ends up multiplying and multiplying and multiplying. Every day your disease is just exacerbating and you're not improving. So what do? Usually we advise our people in Uganda, our patients in Uganda, to desist from self-medication, desist from unnecessary taking of antibiotics. When you don't need them, don't take them. What we emphasize is to restrict ourselves from buying these drugs which are not prescribed at all by a professional health worker, but you end up taking it thinking it will work for yourself. That is self-medication. Then what we also need to do is to make proper diagnosis. As health workers, we need to make proper diagnosis of our conditions, of our diseases, so that you know that if I'm treating a streptococcal infection or staphylococcal, then I have to use cloxacillin or ampiclox, which can shoot this bacteria very well. But if you end up using something like Cotrim, Septrin, then it won't help very well. So we need to have also proper diagnostic tools to make good diagnoses, so that we prevent acute microbial so that we avoid antimicrobial resistance. Now, the other thing we need to do is proper use of labs, because if you go to the lab and you are checked very well, it means your lab results will assist the clinician to make a proper diagnosis. But if you do suspect something, a disease, and you just treat, what does it mean? That you're just going to treat something you don't know, you're not sure of, which you don't have evidence on it, and you treat. By the end of the day, patient is not improving and will come back to you that, my doctor, I'm not improving. So what do? Then you choose blindly, you choose another antibiotic, which still may present with the same. So proper use of lab tools may also help us in curbing drug resistance, and also antimicrobial resistance. So we also need to improve the lab infrastructure. We need to have more of professionally employed health workers. And you see a professional health worker, what happens? Is going to follow your steps in treating you. I don't know where I'm getting this allergy. It's going to follow you up very well and give you proper medicine after testing, after thorough checking, after thorough taking of history, so many things, other than you just come and pick. Because most of us, what we do, we just go to where they sell drugs and they say, give me that Cipro. May I want that Cipro. I don't want the things of swallowing many times. You don't want anything which can be swallowed like 6 hourly. You don't want 8 hourly. You want once a day. You want twice a day. Because this is what you're feeling. But what you want to be swallowing a day, or twice a day, or once in a day, may not be the proper drug for you to use. So if you have a professional health worker, then that professional health worker will advise you accordingly. So we also need to enforce policies, especially policies like that of National Drug Authority, who should prescribe antibiotics, who should sell antibiotics, because they're in class C, like Ampiclox is in class C, so it should not be in these small drug shops. So nurses are not they're not supposed to, especially certificate nurses, nursing assistants, are not supposed to prescribe Ampiclox. Those are class C drugs. Then we need to collaborate with our implementing partners to see that most of these either health workers or people, patients, are given enough health education. They are given enough advice on how to handle the situation. We need also to set up antimicrobial stewardship. Okay, we need to be at the front to fight antimicrobial resistance, because if we are, as health workers, if you're not in front of this, then that means that we shall have as many antibiotics being abused. At the end of the day, we shall not be able to treat our people and they get cured. We also need to create centers of excellence. So if we discover that this facility is doing well, in AMR is doing well, and it is following up the steps, for example, that a patient comes with a prescription. Whoever doesn't come with a prescription is chased off. And the other way is having water nearby, that if someone wants to swallow, can swallow. Someone can get proper advice, swallow every 4 hours, swallow every 6 hours, swallow every 12 hours. Then, if side effects are also told to this patient that if you take this drug, it can cause constipation, it can cause abdominal pain, it can cause a fever. So these ones will help a client to pick confidence from you, and this client will come back to you. So we also encourage patients to always use prescriptions, and these prescriptions are always forwarded to a desk where, in a pharmacy, where they write only prescriptions here. So you go to that place, present your prescription, and you're given the medicine you want. But this business of just going with your mouth, give me Augmentin, should stop. It should stop, it should stop. So I'm advising every client, every patient in the community to always seek medical advice on most of these things, so that you don't take antibiotics for nothing, you don't create resistance. Nowadays, most people are not responding, and what we do culture and sensitivity. Now, culture and sensitivity, you put like more than 5 antibiotics. Let me say, we put like 10 antibiotics, and you find that out of those 10 antibiotics, only 2 antibiotics are sensitive to the bacteria which is disturbing you. So this one has brought a difficulty in health workers choosing what to give you, because you have already taken them before reaching a professional health worker's table. And this one has already created expenses, because you going for drug resistance is an expense. Then also waiting for some days until you get the results is also an expense. Then the other way is you may buy expensive drugs where you could have used a simple drug, but now you go for expensive drugs because these simple ones you have taken them and you know them and you have taken them whenever you want, which does not make sense. So I leave this platform advising you that always see a professional health worker to treat all your ailments, and it will prevent self-medication, and in the long run it will prevent antimicrobial resistance to most of the common drugs we have. Thank you for listening.